Good evening, my beautiful family. I hope you're so good. I'm so good, blessed, loved, and everything goodness and mercy from my Lord King Jesus. How about it? Okay, my name is Unteti Lewesi, and I am your kidney health advocate slash kidney failure patient and life with stage 4 kidney failure. How I tackle everything. Okay, thank you so much for joining. To my regulars, thank you always for joining, for liking, for commenting, for subscribing. I appreciate your love and your support. And to my new people, my new family, welcome family. I love you so much. It's a safe space. You can ask any questions. Feel free to ask me anything. You're welcome. This is a loving space, just full of love. We just want love this side because I am love. God loved me. Okay, so I need love as well. So welcome. You're welcome. Settle down. Okay, don't go anywhere. In radio, we say do not press that down. So do not change that down. Okay. Alrighty. So on today's topic, we will be talking about what are the causes of fluid retention as a kidney failure patient. Remember the last video I talked about I suffered the most severest toxin ever, which is fluid retention. So today I'm going to talk about what are the causes of fluid retention and the after effects of fluid retention, because fluid retention is no child's play, ladies and gentlemen. This thing is not nice. It's not nice at all. Okay, so on number one, I'm going to talk about how I suffered fluid retention. Okay, don't judge me. First and foremost, do not judge the care. I'm just a human living life. Okay, so apparently I suffered fluid retention. Okay, remember, like I said before, I used to go for 3 hours only and 2 times in a week. Now I go for 3 times in a week. 3 times in a week in 4 hours, right? So I used to go 2 times and 3 hours only. Fine. And for blood cleansing only. Now I go for fluid outtake as well. So apparently I used to skip some Fridays. Because I used to go Monday and Friday only, so I would skip like Fridays and not go about a type of vibe. So that's where I accumulated the fluid. Because I skip it to go to our okay, this one time only. I'm confessing this one time. But I went the following day. I went on a Saturday. So it's not bad. Robert. So at least I attended. So yeah, so that's how I accumulated fluid, right? And I remember this one time, I wish I went then. I thought I was ovulating and I was sick because of that hunty. It was water. And I wish I had gone then, and I did not go because I was sick and stuff. So, but I'm alright now, and the fluid is being taken out. I'm healthy. I'm happy. I'm so cute. Okay, but yeah. So I apologize, fam. The kidney health advocate is Rama. I do make mistakes, guys. I'm a person and stuff after all. Like, it's not like I get more like I do make mistakes, okay? I do. But anyways, I'm forgiven. I'm still healthy. It's me forgiving myself for me, okay? So please don't mind my voice because I'm trying to like limit water intake. You see, this thing is a lot. Fluid retention. So yeah, don't mind the cranking and yeah. Okay, number 2 on what are the causes of fluid retention is inadequate dialysis. If the dialysis treatment is not effectively removing excess fluid from the body, it can lead to fluid retention. This might happen if the dialysis sessions are too short or not frequent enough to adequately remove the accumulated fluid. So when you're cutting your dialysis sessions short, and you know it's 4 hours, you have to perform that 4 hours. Like for example, with my Motel FM interview, I had to cut it short, and it did not help. The following day I went to CTFM induction. We had an induction and we had to do like a physical exercise. I could not perform it because I was not well. I had fluid within my body, so it was not working out at all. So yeah, I could have been active, but because of the fluid awareness, so yeah. So I advise that if you're kidney failure patient, please go for that 4 hours. If you know how you have somewhere to go an hour before, so that you can perform your session. Okay. So number two is dietary choices. Consuming foods or drinks high in sodium salt can lead to fluid retention, as sodium causes the body to retain water. Kidney failure patients need to follow a strict limit sodium intake. Yes, it is true. Last year when I started to suffer fluid retention December, I remember I ate salt and vinegar chips. After that, I've never felt so sick in my entire life. Like when I turned around, I've never been so dizzy. I do not have control at all. And I started becoming sick. That's when it started over. So I think for me, okay, sorry for the cut out. Something kind of disturbed, but okay. On the dietary choices, you have to limit your salt intake. Like I said, I ate salt and vinegar, chips, and honey. Did I not feel so dizzy in my entire life? I did not have control over it. I did not know how to react because it was new. Now I know, okay, if I'm feeling a bit of fluid, I know how to control it. Then I did not know anything. I was sick, I was crying, I was so dizzy. Like, yo, I don't want that experience anymore. So please limit your salt intake. Even for you people that don't have kidney failure, please limit that salt. Salt is not good. You must ask Dr. Vera Matisela. I used to love him so much. Those ads, loved him loads. And then medications, some medications such as non-steroidal anti-inflammatory drugs or certain blood pressure medications can lead to fluid retention in kidney failure patients. Like I said on my first introduction video, the reason why I'm here today, it was because of negligence of public hospitals. My dosage was too high on my pills. They were not attentive today, and here I am. So medications as well, such as non-steroidal anti-inflammatory drugs, can lead to fluid retention. Residual, and number four, residual kidney function. In some cases, kidney failure patients may still have limited residual kidney function, and this can result in the body retaining excess fluid. So if your kidneys are tired and can't help themselves, it can really lead to such as well. So please do check your kidneys on a 3 months basis or 6 months, however you can. Always do blood test, okay? And number five, into dialytic weight gain. The amount of weight gain between dialysis sessions can be an indicator of fluid retention. Excessive weight gain may be a sign that fluid intake or dietary habits need to be adjusted. So sometimes you might think, okay, you have gained weight within the body. So you do not gain weight. It's water, dirty water that needs to go out, okay? Yeah, it's not dirty water, but it's just water. So, by the way, don't be shocked if I do my research proper, because I'm not a professional dialysis technologist or nephrologist, which is a kidney doctor. So I have to do my research so that I can tell you good things, okay? And as much as I suffered them, I know certain things practically, but theoretically, there's actually more information actually. So on our second segment, we're speaking about after effects of fluid retention. Yes, the after effects, what it can do to your body. Okay, so fluid retention, also known as edema, can have various after effects depending on the cause and severity. Some common after effects of fluid retention include swelling. The most noticeable effects of fluid retention is swelling, often in rare places. Your feet. My feet, there are these heels that I love. Plastic heels, cute. My feet used to be so swollen before I found out that I had kidney failure until it was water retention then. So yes. Number two, it is your ankles. Your ankles can be swollen. Your under eye bags as well. Your under eye bags. You must see me every Monday after the weekend. I am swollen because of drinking water, juice, oros. Yeah, so you must be very careful. And also your fingers, My finger, especially this finger of mine, it can be so swollen. And then weight gain due to excess fluid being retained in the body, individuals may experience a temporary increase in body weight. You might think you have gained weight, but it is water, like I said on the courses. You might think you have gained weight. It is water inside of your body, so you must take out that water before you become sick, okay? If you have kidney failure, yes. And then discomfort. Discomfort, swelling and bloating can cause discomfort, pain, or a feeling of tightness in the affected areas, especially lungs. Abdomen can sometimes, especially lungs, abdomen, and sometimes fingers. Pardon me. So, like I said, your fingers, especially this finger, it can become really one high. You know, your abdomen. I remember last year when I started to suffer fluid retention, I called my dialysis technologist, and I was like, I'm not even active. I don't know why is my abdomen swelling. Why can't I go on my periods? This and it's like, where is swollen, you know? And I was so frustrated. I remember telling my doctors, I'm like, can it also relate to menstruation? It's like, no, it's two different things, but it can affect your cycle, you know. But I was so frustrated. I thought I was Virgin Mary, guys. Like, I thought there is something in the belly. I don't want to lie to you guys. Like, I thought it was Virgin Mary type of vibes because, you know, me, I'm innocent. Okay. I thought it was that. And Khanti, it was just water for in my body. You could have seen me. Yo, I was so swelling. You also could have thought the same, okay? Don't judge the girl because the girl is just a human being. Thanks. Okay, so I thought that, honestly speaking. Okay, and then reduce mobility. Severe edema can limit mobility and make it difficult to move affected body, like your feet. It reduces you walking fast. It reduces you just being active because you're tired, you're full of water, you know. So yeah, so it's not nice. Like recently we had a CTFM induction and I could not run because of the water that was full in my body, you know. So I had to cut it short because of my prior Moto FM interview. So yeah, but I'm fine now. So it's not a nice feeling at all. I don't want to lie to you. It's very not nice. You are swelling. You are sweating as well under your feet, you know. So it's a lot going on. Skin changes. The skin over swollen areas may become stretched, shiny, or pitted. Even after fluid outtake, I become dry. My skin changes so much. I can see by yellow but I change. And also when I overdo the 2 liter, my skin becomes very dry. Like I used to have dry skin, yeah, and then became better last year, and then this year again it started over because of the fluid outtake. And so my skin became very dry, but my doctor prescribed to me the best product ever, Epimix, the plug. So it helped me a lot, you know. And then changes in blood pressure. Fluid retention can affect blood pressure and potentially leading to high blood pressure in some cases. Example, for me, my blood pressure was normal. Okay, it was normal. You see those two numbers, I don't know which one is supposed to be high and the other one, I don't know, honestly. But all I can tell you is that my blood pressure was okay. Now it is not right, it is high, it is not even, it's a lot going on in my blood pressure, my pulse as well. But God is still good. Okay, breathing difficulties. Severe fluid retention, especially in the chest or lungs, can make it harder to breathe. Example, mine in December, I could not breathe, my loves. Let me tell you something. When I got admitted, my heart rate, my lungs, I remember my nurses, when I went to casualty December 2, they were supposed to, like, my heartbeat was high, you know, everything in my lungs. And I remember I was also taken for x-ray for lung to check if I don't have lung infection, because it can ruin, it can give you lung infection. So it's a lot this side, it's a lot, but God is a lot, honey. God is good irregardless. So number 8, last but not least, actually it's not last, we have number 9 as well. Weakening of the heart. Chronic fluid retention can strain the heart, potentially leading to heart problems if left untreated, like I said. my heart rate was so high, yo. And then underlying conditions. Fluid retention can be a symptom of an underlying medical condition such as heart failure, kidney disease, or liver disease, which is true because if you've seen people that have heart diseases, mandobana atlala, their legs become full, can't take water, and that's why they're continuously like given water so they can urinate it out, you know. So yeah, that is the causes of fluid retention and after effects of fluid retention. So I suffered it and I'm still suffering it, okay, but now I can maintain it and manage it due to the dialysis sessions. I'm super grateful to God that I'm able to attend those sessions because some people can't at all, and some people they die even before attending these sessions. And I'm super grateful to God that he still sees the potential in me to make something in this world, you know. That's why I'm alive today. Thank you so much, family, for your support always, for your love, your care, your everything, my loves. Like your everything. I love my loves now. It's so cute and stuff. Thank you so much. And to my new people, my new loves, welcome. This is home, like I said. This is a loving place. Do not forget to subscribe, like, share, and comment. Send out the love to people that have kidney failure. Support them always. Pray for them. You know, with kidney failure, you need support of friends, family, and also be there for every person who has kidney failure. And for you, my loves, who do not have kidney failure, please take care of your kidneys while it is still early. You know, take care of them. Do your research on how to take care of them. You know, so I love you all so much. May the good Lord bless you and may his face shine upon you always. My name is Ontentile Maurice, your kidney health advocate, your dynamite, your hun, a loved girl. Thank you so much. I love you so much. Good night and God bless. I'm about to watch the ball. Okay, that's why the closing link, I want to push it, and it has already started if I can hear correctly. Yeah, so bye. See y'all. Crossing fingers for the ball. Okay. Hallelujah. Good night. God bless you.